Nurse Vivian May V. Sangüesa from NUR 224B. Today, I am going to perform donning and removing sterile gloves via open method. A further defense against bacterial translocation is sterile gloves. These are worn throughout various operations to allow the nurse to freely touch sterile things and to prevent clients who are at danger from getting sick from microorganisms on non-sterile gloves or the nurse's hands. The nurse can avoid coming into touch with blood and bodily fluids by using sterile gloves. Nurses can easily handle or touch sterile objects while wearing sterile gloves without contaminating them. Additionally, it stops the nurse from transferring potentially contagious organisms from her hands to patients who are at a high risk of infection. So prior to the conduct of the procedure, we must make sure that we perform a thorough hand washing before wearing a sterile gloves. Okay, so now, we should prepare a sterile gloves that is needed for the procedure. We must ensure the sterility of the package of gloves. Additionally, the gloves must fit well in our hands to ensure that our hands is comfortable. First, our step, we will remove outer glove package wrapper carefully, separating and peeling the sides apart. Place the package of gloves on a clean, dry surface. Prevent inner glove package from accidentally opening and touching contaminated objects. After that, we will grasp inner package and lay it on a clean, flat surface just above waist level. Open package, keeping gloves on wrappers inside surface. Sterile object held below waist is contaminated. Inner surface of glove package is sterile. Then, we will identify right and left glove. This is the left glove and this is the right glove. Each glove has cuff approximately 2 inches wide. We should glove our dominant hand first. My dominant hand is the right hand. Proper identification of gloves prevents contamination by improper fit. Gloving of dominant hand first improves dexterity. With thumb and first 2 fingers of non-dominant hand, grasp edge of cuff of glove for dominant hand. Touch only inside surface of glove. Inner edge of cuff lies against skin and thus is not sterile. Next, carefully pull glove over dominant hand, leaving cuff and being sure that it does not roll up the wrist. Be sure that the thumb and fingers are in proper spaces. If outer surface glove touches hand or wrist, it is contaminated. With glove dominant hand, slip fingers underneath cuff of second glove. Cuff protects glove fingers. Sterile touching prevents glove contamination. After that, carefully pull second glove over non-dominant hand. Do not allow fingers and thumb of glove dominant hand to touch any part of exposed non-dominant hand. Keep thumb of dominant hand abducted back. Contact of glove hand with exposed hand results in contamination. Now, let's move on removing our sterile gloves. We should grasp outside of one cuff with other glove hand. Avoid touching the wrist. Pull halfway down the palm of the hand. Take thumb of half ungloved hand and place it under the cuff of other glove. It minimizes the contamination of underlying skin. Next, pull the glove off, turning it inside out. Take fingers of now bare hand and tuck inside the remaining glove cuffs. Peel glove off inside out. After, we should discard it in receptacle. Outside of glove must not touch skin surface. That's all for my return demonstration entitled donning and removing gloves. That's all. Thank you for watching.